Hello, my name's Kevin Baker. I'm a hypnotherapist at Clarity and Wellbeing. In this short audio today, I'd like to answer a question which we are frequently asked by people who are considering hypnotherapy for the first time. And that question is, what actually happens in a hypnotherapy session? Okay, so let me just quickly run through, broadly speaking, what happens. When the person arrives for their session, we take the time to have a chat for a few minutes so that both people can become acquainted, okay? Build rapport, if you like, and this is really important. Now, for some treatment types, such as weight loss or a quit smoking, then we would have already sent the person a questionnaire, a short questionnaire by post, which they would fill in and send back to us. But for most other treatment types, we would take the opportunity in the first session to, if you like, gather information, ask the client a little bit about their current lifestyle, the positive change or changes that they've come to see us and they want to make, whether they've tried to make these changes in the past and this sort of thing. Okay, and we would then take the opportunity to, following this information gathering stage, and I just must point out actually that one of the main reasons we do this information gathering, is so that we can use the information that we collect to build the session or sessions specifically for that person, uniquely for that person, so that they're not off-the-shelf sessions there, and they become much more powerful that way, much more effective and successful. Okay, so following the information gathering, which is just a few minutes at the start of the first session, we would then give the person the opportunity to ask any questions. And it's important that we do this because we don't want them going into the session with questions hanging over them that they haven't got the answer to. Okay, we then begin the main part of the session, which is inducing trance. Okay, once trance has been induced, we deepen the trance state in preparation for the next stage, which is the actual therapy, where the actual therapy takes place. So trance is induced, the state of trance is deepened, and then we perform the therapy, and that's making the positive changes that the person wants to make by talking directly to the person's subconscious mind. Okay, so once the therapy has taken place, we then make sure that we provide some what we call feel-good suggestions. Now these are suggestions that we give to the person's subconscious to make them feel really good about the positive changes that they're making in their life, so that when they leave us they feel really good about themselves. Okay, this is really important. And then after doing that, the person would emerge from hypnosis. Okay, they would emerge from hypnosis, and finally, unless it's a one session treatment, we would give the person a little bit of homework to do between sessions, and this may involve having a read of some tips or learning one or two little techniques which we would run through with them before they leave. And these tips and techniques we're very proud of at Clarity and Wellbeing, because they really reinforce everything that we do in the sessions to make the whole process of this positive life change much more powerful, much more rapid, much more effective, and much more permanent. And we're very, very proud of that. Well, I hope that rather quick run through of the contents of a typical hypnotherapy session was useful for you. If you do have any further questions or you'd like to discuss this further, then of course I'd be delighted to help. Thanks very much for listening, and goodbye for now.